Hello there, my name is Jennifer Boutelle, and this presentation will inform about the Nurses Health Study. We'll go over specifics about the study and its intentions, as well as review the study sample and how generalizable this data is to all women. This was initiated by research at Harvard, T.H. Chang School of Public Health, and Brigham Women's and Children's. Some information about the Nurses Health Study and intentions. It started in 1976, which was 50 years ago. The Nurses Health Study is among the largest prospective investigation into risk factors for major chronic diseases in women. There are more than 275,000 participants. This is a very large study. This study collects information via questionnaires, so about lifestyle, reproductive, and environmental factors, and uses it to investigate risk factors for chronic disease. So questions they might ask about might be diet, exercise, smoking, hormone use, sleep, and then they take that information to see how do these risk factors relate to chronic diseases like diabetes, cancer, or heart disease. And then all of this information is used to help shape public policy and health recommendations. Overall, the intention or aim is to generate robust epidemiological evidence to inform public health recommendations and clinical practice guidelines for women's health. So the question here is, using nurses as participants, is this generalizable to all women? And my answer is yes. A nurse is a very appropriate way to study the risk factors for chronic diseases in women. There are some limitations to this. So the pros, this study's been going on for 50 years. There's a large duration of the study and sample size, a large number of people. Nurses have medical knowledge, so they can reliably self-report on health information. There have been very high follow-up rates, and it could potentially reduce confounding variables as nurses have similar educational levels. There might be some limitations with generalizability. Nurses, of course, do not represent the entire population of women, and nurses may have better access to healthcare. They may be predominantly more white, so less racially diverse. And, other factors, is there something related to the occupation of nursing influencing the results? But overall, having this data has definitely been very helpful to inform public health decisions. So this information is based on the future of nursing as well as some of our course content. We've talked about that nurses must champion public health and promote overall well-being and health through policy and advocacy. So given our unique position as frontline nurses, we are especially well positioned to shape healthcare policy in very meaningful ways. At the same time, we also must prioritize our own health and well-being so we can take care of ourselves to provide safe, effective care to others. Here are my references. Thank you again.